Unraveling the GI Mystery, Copanlisib-Induced Colitis, presented by Dr. Shah, PGY2 at Northwestern Medicine McHenry Hospital. This presentation focuses on a case of drug-induced colitis, highlighting the clinical presentation, diagnostic process, and management strategies. A 77-year-old female presents to the ED with chief complaint of generalized weakness, diarrhea, and associated epigastric pain and chills for the past few months. Normally, the patient has one formed bowel movement per day, but she has slowly started to have 3 to 4 loose movements per day, sometimes bloody. Outpatient medications such as loperamide and antibiotics did not improve symptoms. Of note, patient has refractory B-cell lymphoma and recently started copanlisib therapy 6 months ago, with her last infusion 3 weeks prior to presentation. Patient was afebrile, slightly tachycardic, and had a blood pressure of 101/53. Physical exam was notable for dry mucous membranes, and her abdomen was mildly tender in the epigastric region. Diagnostic workup revealed significant inflammation with elevated CRP and fecal calprotectin, without evidence of infection, prompting further investigation. GI film array was negative, and C. diff studies were suggestive of colonization rather than active infection, as PCR was positive but toxin was negative. Imaging studies were significant for a CAT scan done in the ED. The results, which showed moderate pancolonic mucosal and wall thickening, noted in the majority of the colon. Gastroenterology was also consulted, and they ultimately performed a colonoscopy with biopsies. Findings on colonoscopy were significant for edematous, granular, and ulcerated mucosa, with loss of vascular pattern, as noted on the image. The pathology report was interesting, as it noted acute and chronic inflammatory changes. Although the chronic changes in both specimens are mild, the findings of acute and chronic inflammatory changes raise the differential diagnosis of inflammatory bowel disease, chronic infection, or drug injury, among other entities. No granuloma or dysplasia was identified. Numerous diagnoses were ascertained throughout this case. The overall clinical picture, including lab work, CAT scan results, colonoscopy findings, and pathology report, supported drug-induced colitis, however. C. diff infection was effectively ruled out, as patient more likely had colonization. Infectious workup was negative. The symptoms were not suggestive of irritable bowel syndrome, and inflammatory bowel syndrome does not generally first present in the elderly. Once identified, the management strategies involve stopping the offending drug and starting corticosteroids and 5-ASA agents such as prednisone or mesalamine. Supportive care also involves administration of IV fluids, electrolyte replacements, and nutritional support such as high protein or brat diet. Copanlisib is a PI3K inhibitor which is suspected to cause colitis through faulty immune system modulation, which causes an inflammatory response in the GI tract. It is a rare side effect which requires vigilance and awareness for early detections. Patients who are started on copanlisib and other PI3K inhibitors should be closely monitored for these GI symptoms, especially in the initial months, as the disease can be resolved with prompt recognition and initiation of corticosteroids and 5-ASA agents. Research on copanlisib-induced colitis is relatively sparse, but several studies and reviews discuss the GI toxicities associated with these PI3K inhibitors, including a literature review published in the journal Cancers, which discussed a link between GI side effects and PI3K inhibitors. Additionally, a phase 3 double-blind randomized placebo-controlled trial known as CHRONOS was published in The Lancet, which provided detailed long-term safety data on copanlisib. It noted that colitis and other immune-related adverse effects can develop over time. These studies emphasize the importance of monitoring for colitis and adjusting treatment protocols to manage these toxicities effectively. This case underscores the importance of monitoring for GI side effects in patients treated with copanlisib. Early intervention and appropriate management are keys to preventing severe complications and ensuring positive patient outcomes. This concludes the presentation. Thank you for your attention.